There's no
Yeah.
reason for your client who's young, a teenager, to fear that anything that he or she is facing, not being able to discuss with their children, is ever going to get leaked to the parents. It's always going to remain between me and my counselor, and I will get the
Yeah.
help that I require, because these are things that I'm not being able to talk to my parents about.
Absolutely. And I want to add something here.
Yeah.
It's also important for the child to also know that there are some things that an adult needs to know. So, like I said, this confidentiality also has certain clauses, right? So, in case if there is, if the child is you know has a risk of being harmed or is going to harm someone, that time the confidentiality clause doesn't hold true.
Are the parents okay with leaving their kids to the counselors, letting them deal, or do they tend to end up getting nosy? And what do you tell parents who tend to end up getting nosy, that I'm dealing with the child, leave me alone?
I think parents are always remain quite anxious about whatever is happening in the counseling sessions and all.
Of course, and
But
they will be always.
always, so I think, but the psychotherapy to start or to build up a rapport with the young child, definitely we have to ensure that this is a safe platform for them to discuss, to reveal or whatever they have not discussed with the parents or other members of the family, so that he or she can be helped in the best manner. So if that sort of message go from the therapist, definitely child feel very much comfortable to discuss his or her issues also. But along with that, we have to give psychoeducative sessions to the parents also, help them to work on their distress, help them to work on their other issues which they are worried about the young child, so that they can feel better, relax. And sometimes we have to teach even relaxation exercise to the parents also, because so that they can relax and they can take a more better look about the child's problems and other issues.
Right. And Dr. Upasana, I would just like to know from you a little about altruism, how it helps all of us in times like this, because everyone looks at their problems in isolation through this magnification. Just to understand that all of us are going through this.
So, like you very rightly mentioned, remember, during the second wave that did hit us all, I saw a lot of young kids also, were encouraged to bring in that support, to bring in whatever they could to provide supplies or groceries to the elderly who did not have a family member and they could not move out. And I believe that acts of kindness, that altruism, gives you a sense of purpose, which is so missing from our lives because we don't see a lot of future right now. We don't know when is this going to come to an end. Every time things start getting better, we then start hearing 2 weeks later cases are rising again. So a lot of lack of hopelessness. There's a lot of lack of hope. Sorry, this lack of hope when is taken care by some sense of purpose in those acts of kindness. It kind of gives you that boost. It gives you that self-esteem boost. It makes you feel nice because you've served somebody, and all of that anxiety or all of that fear, you kind of give meaning to your life. That at the end of the day, we are all together. At the end of the day, I was useful to someone, and that makes you feel nice. So you kind of have some hope around it that despite what's happening outside, I'm still there. I exist here because I serve some purpose in life. And I can do that even if I'm restricted in my home through a lot of other channels. So the kids have used this time, the second wave, and their social media in a very good way also by connecting everybody, by,
Yes.
sharing, resharing. Somebody needed bed, somebody needed oxygen, somebody needed food.
Yes.
So I saw a lot of young kids doing that, making groups, forming support groups, making sure कौन कहाँ रहता है, वो तुम जाओ उसको उधर दवाई चाहिए, that uncle ji lives alone, go do that.
Yes.
So social media was also used very
In a
nicely
positive way.
in a positive way.
And that's such a beautiful way to end this session today, Dr. Upasana, Dr. Manoj. We're all in
Thank
this
you.
together. Altruism works. In case you see some telltale signs of anxiety within yourself, within your family members, go ahead, unmute yourself, speak normally about mental health. Your brain is like any other part of your body.